So our patient here today is coming in. She dropped a big can of tomatoes on her foot about 2 weeks ago, right?
Yep.
And as a consequence, she's developed this really large, what we call a subungual hematoma of her big toenail. So you can see that she's got all of this darkening of the nail, and that's actually blood that's accumulated under the nail plate. We took a plain film radiograph, 3 views today, and we see that she also had a non-displaced transverse fracture of her distal phalanx. So she went to an urgent care facility and was told that there was no fracture. So that just kind of gives you the importance of just proper knowledge of anatomy. And sometimes you miss these very small fractures. So it's just important to get that x-ray today and find out that that was present. Now, one of the reasons why we decide to remove the nail plate is that we want to make sure that there is no laceration to the actual nail bed, because that should be repaired so that it heals up appropriately. The patient has been on antibiotics. They did do that for her. She was on Cipro when it happened. So at least she was covered empirically for any local infection. If you look at the toe, there is no local infection. It looks clean, it looks good, so I think we're in good shape. So we're gonna be removing this nail. Really deep breaths, in through your mouth, out through your nose. You're gonna feel this at your toe. It feels really cold. I'm gonna do it on your foot first so you know what's coming, okay?
Yeah.
Okay, nice deep breaths for me. Okay, so really cold, really cold, really cold. Cold, cold, cold. 1, 2, and 3. Okay, you're gonna feel some pressure and some burning. Doing okay?
Yeah.
All right. This is the worst part.
Really? Okay. Ow.
Okay. So we make sure that we're filling in each quadrant, meaning each quarter of the toe, because that's where the corresponding nerves lie. So we treat it kind of like a square. That's why we call it an H block. So we go through the same injection site and we get the medial side of the toe. That way we raise a wheel and it's not as painful when we have to come in the second time. You're doing great. We obviously give her a little bit more cold spray after we've already raised that wheel just to help. 1, 2, and 3. So this is just some 1% lidocaine. That's the worst part. Nice deep breath, deep breath. Okay, we're almost done. That's it.
Oh, thank you.
Okay. So we're gonna give it, no bone saw. So our patient's been numbed up. We've done our hallux block or H block. So we do our little test to make sure you don't feel anything. Now you will feel pressure and you're gonna feel me touching you, but you shouldn't feel any pain, okay? So we're gonna do a little test. So you'll feel pressure, but no pain.
Okay.
All right? So let me know if this hurts. Any pain?
No.
Good. So our patient's nice and numb. Okay. So we open all of our autoclave tools. Everything is peel packed. Everything is thoroughly processed. Okay, so we get all of our tools ready. Okay, so we are good. Okay, so all of our tools are set. So this is isopropyl alcohol, so we're going to use this to really clean up the procedure site. We've already prepped this before we even did the injection, so this is just an abundance of precaution, trying to keep as cleanly of a site as possible. Okay, so this is our trusty toe tourniquet that we use. right, so you'll feel some pressure. You doing okay?
Yeah.
All right. So you can see that the surrounding skin has really suffered from the trauma. So in this case, what we're gonna do is we're gonna use the end of a freer elevator, and we're gonna start to gently lift the surrounding nail border on this patient. Now, this is something that is 2 weeks old, so you'll notice that there's going to be some coagulated blood. There may be some local infection, although it does look okay, but certainly it's something that needs to come off. You can see the nail is very, very loose. So the best thing to do here is to be as careful as possible, as to be as atraumatic as possible, which gives us the best chance for this nail to grow back normally. Doing okay?
Yeah.
So we use a variety of different instruments to be able to do this. So you can see the nail is lifting already. So we come in and we clamp a corner of the nail, and then we come in with our 15 blade and we gently tease away the attached skin. And then we'll come back with a tissue nipper to clean everything up. Okay, so there you have it. That was the nail. It was attached. You can see the underside of the nail has coagulated blood. That should be removed because that could be a harbor for infection, so it's off, okay? So now I like to come in and clean off everything really, really well to see what's left. Okay. And we start to clean up anything that is loose or devitalized, which is just a fancy word for it's no longer alive. And then we come in with a tissue nipper and we just start to just clean up all the edges. Now, what I was looking for was to make sure that there was no laceration to the nail bed, and there isn't. The nail bed actually looks really healthy. She had just a little superficial abrasion here that's bleeding, but nothing that's an open laceration that extends down into the bone because, again, there was a fracture, so our concern is that there's nothing extending down into that fracture site. So that really creates a safe environment for that fracture to heal without the concern for an infection to happen. All right, so we've cleaned off that excess dead skin. Everything looks good. Nail looks good. Painless so far?
Yeah.
You're doing well?
Yeah, I can't believe it.
Okay, good. Good, I promised you.
Good.
Yeah. Okay. So one more really thorough irrigation. Okay, so everything's nice and clean. So what I do now is we apply our triple antibiotic ointment, and this really serves two purposes. Obviously, it's going to help prevent any local infection, but also it acts as a non-adherent so that the bandage that we put on there doesn't get stuck to that nail bed, because that nail bed is really tender. It's brand new skin, so it can get stuck to any gauze that you put on there. So you want to put a pretty healthy amount of ointment on there so that that doesn't happen. And beyond that, we even go a step further and we put some Zeroform, which is another non-adherent dressing, to prevent anything from sticking. I do all of this while the toe tourniquet is still on. That way we have a bloodless procedure site. It lets us put a really clean dressing on there. So everything goes on there as the tourniquet is still up. I then just put a little piece of gauze on there to tamponade any of the bleeding. And once we've done that, we come in and we remove our toe tourniquet. That part I wouldn't recommend doing at home. I've done it several thousand times. So we just remove the tourniquet, and now we just put a dressing on there. All right, there you have it.
Oh my gosh.
Traumatic nail avulsion.